Connections is an outpatient exercise and education program for people that have had any type of heart or lung conditions. Cardiac rehab is a 36-session program where you come 3 days a week, monitored on telemetry, and to be eligible for the program, most patients have to have had some type of cardiac surgery, whether it be bypass surgery or stent placement. They could also have had a heart attack within the last 12 months. A diagnosis of congestive heart failure, and also a transplant, heart transplant or even a lung transplant. The advantages of attending our cardiac and pulmonary rehabilitation is that the patient would be monitored on telemetry so that we can monitor their ECG the entire time they're exercising. We can also monitor their blood pressure, their heart rate, and their pulse oximetry. The other benefit of coming here is that we have different types of staff that work here, such as nurses, exercise physiologists, athletic trainers, respiratory therapists, and dietitians. For those patients that have completed a cardiac or pulmonary rehabilitation program, we offer a maintenance program that is unmonitored, meaning that they don't wear the telemetry. However, we do have our staff still here on hand to answer any questions that they may have. Our cardiac rehab program has recently received a certification through the AACVPR, which is a nationally recognized program for cardiac rehab. With our pulmonary rehab program, you can get up to 24 visits in our facility that's also telemetry monitored, and we see participants that have different lung conditions such as COPD and pulmonary fibrosis. The benefits of exercising on a consistent basis include improvements in your heart rate, blood pressure, cholesterol levels, and even your diabetes. A benefit of exercise for a diabetic patient is that the diabetic patient could see their blood sugar levels drop and also their overall hemoglobin A1C lower. All of our programs require a physician referral, and it does not have to come from the cardiologist or pulmonologist. It can be from any physician that you see. We do send reports to your referring physician at least every 30 days so that they can see your progress in our program. The staff that work here are wonderful. A lot of the feedback I receive from patients state that they are kind and caring, personable, and very knowledgeable. You see a lot of interaction between the staff and the patients, which is what we want to see so that the patient does know that we care. I feel that our department enhances the overall patient experience because once a patient comes through either the emergency room or the cath lab, if they're an inpatient, we do go up on the floor and see those patients. Once they've been discharged from the hospital, they are now considered an outpatient and they can come back to see us, where we can watch them 3 days a week and also send reports to their physician so the physician knows how well they are doing. Health Connections has grown over the last several years, and a lot of that tells me that word is getting around that we have a great program here and that patients want to come here and experience that. It's not just about the patient exercising, it's about the patient getting better, the patient connecting with other patients that are in here. I feel that House and Healthcare invests in the community by sending their staff members out to the community to do a lot of education about different things such as heart disease, lung disease, diabetes.